If you're over 60, there's something very important you need to understand about your arteries. Blocked arteries don't happen overnight. They build silently, year after year, often without pain, without warning, until one day the body simply can't compensate anymore. Heart attacks, strokes, fatigue, shortness of breath, these are not sudden events. They are the final chapter of a long process. The good news is this: your body has an incredible ability to heal when you give it the right tools. After the age of 60, something silent and dangerous begins to happen inside your body, and most people never feel it coming. Your arteries don't suddenly clog overnight. They slowly lose something essential, something your survival depends on every single second: nitric oxide. This tiny molecule, invisible to the eye, is one of the most powerful protectors of your heart and blood vessels, and science now confirms that its decline is one of the main reasons heart attacks and strokes explode after 60. Nitric oxide is not a supplement trend. It is a biological signal your body uses to tell blood vessels to relax, widen, and allow blood to flow freely. When nitric oxide is abundant, arteries stay flexible, blood pressure stays controlled, oxygen reaches your brain, heart, and muscles efficiently, and plaque struggles to stick to vessel walls. When nitric oxide drops, arteries stiffen, pressure rises, blood flow slows, and damage quietly accumulates. Here's the shocking part. Research shows that by the time you reach your 60s, nitric oxide production can drop by up to 50% compared to young adulthood. That means your blood vessels are operating with half the protection they once had, even if you feel fine. This decline doesn't announce itself with pain. It announces itself years later with a diagnosis. Endothelial dysfunction is the scientific term for what happens next. The endothelium is the thin inner lining of your blood vessels, and it relies heavily on nitric oxide to function. When nitric oxide levels fall, this lining becomes damaged, inflamed, and sticky. Cholesterol particles start attaching more easily. Calcium deposits form. Plaque begins to harden. This is the true beginning of blocked arteries, long before symptoms appear. Multiple clinical studies published in cardiovascular journals show that low nitric oxide availability is directly linked to hypertension, coronary artery disease, cognitive decline, and reduced exercise tolerance in older adults. In simple terms, when nitric oxide disappears, aging accelerates from the inside out. This is why blood pressure often rises after 60, even in people who never had problems before. It's not just salt, it's not just stress, it's the loss of the body's natural vessel relaxer. Without nitric oxide, arteries lose their ability to respond, adapt, and protect themselves. And here's another fact most people don't know. Nitric oxide doesn't just affect your heart, it affects your brain. Reduced blood flow caused by nitric oxide deficiency is associated with memory problems, slower thinking, and increased risk of vascular dementia. Your brain consumes about 20% of your body's oxygen. When blood flow suffers, so does mental clarity. This explains why many people over 60 experience fatigue that no amount of sleep seems to fix. Cells are literally starving for oxygen and nutrients. The heart works harder, the body compensates, but compensation has limits. Now here's where hope enters the picture. Science has proven that nitric oxide levels can be supported naturally, even later in life. One of the most studied and effective ways is through dietary nitrates found in certain plant foods, especially beetroot. When consumed, these nitrates are converted by oral bacteria and enzymes into nitric oxide through a pathway that becomes even more important as we age. In fact, studies from institutions like the National Institutes of Health show that older adults respond especially well to nitrate-rich foods because their natural nitric oxide synthesis pathways are impaired. In other words, your aging body needs this support more than a younger one. Clinical trials demonstrate that regular beetroot consumption can reduce systolic blood pressure by 4 to 10 points, sometimes rivaling the effects of first-line medications. Lower blood pressure means less strain on artery walls, less micro-tearing, and slower plaque progression. But the impact goes deeper. Improved nitric oxide availability enhances endothelial repair. This means blood vessels regain some of their flexibility. Blood flow improves, oxygen delivery increases. The heart doesn't have to work as hard to push blood through narrowed passages. There's also a powerful anti-clotting effect. Nitric oxide inhibits platelet aggregation, reducing the likelihood of dangerous clots that can trigger heart attacks and strokes. After 60, when blood naturally becomes thicker and more prone to clotting, this protection becomes critical. One study found that older adults who improved nitric oxide bioavailability showed better walking endurance, improved balance, and reduced risk of falls. This isn't just heart health, this is quality of life. And here's the most overlooked truth. Medications often manage symptoms, but nitric oxide addresses the root problem, vascular dysfunction. That's why lifestyle and nutrition matter so profoundly after 60. You are not just feeding your body, you are signaling it. Every time you support nitric oxide production, you are telling your arteries to relax instead of tighten, to heal instead of harden, to protect instead of collapse. This is why people who prioritize nitric oxide supportive nutrition often report warmer hands and feet, improved energy, better stamina, clearer thinking, and more stable blood pressure within weeks. These are not placebo effects. These are physiological responses to improved circulation. Aging does not mean your arteries are destined to fail. It means they require more intelligent support. The tragedy is that most people never learn this until it's too late. They wait for a warning sign. But blocked arteries don't warn you. They ambush you. Understanding nitric oxide after 60 is not optional knowledge. It is survival knowledge. Your body is still listening. Your blood vessels are still capable of responding. And when you restore what time has taken away, you don't just add years to your life. You add life back to your years. And that is why nitric oxide is the molecule that can quietly decide how well you age, or how suddenly everything changes. What happens when 3 ordinary foods come together is not ordinary at all. Beetroot, lemon, and ginger don't just add nutrients to your body, they activate biological systems that aging quietly shuts down. And after 60, this combination becomes less of a wellness trend and more of a physiological intervention your body has been waiting for. Beetroot is the foundation, and science explains why. Beets are one of the richest natural sources of dietary nitrates ever studied. These nitrates don't act directly. Instead, they enter a conversion pathway that modern medicine finds remarkable. Friendly bacteria in your mouth convert nitrates into nitrites, and once swallowed, those nitrites are transformed into nitric oxide inside your blood vessels. This pathway becomes critically important with age because the body's primary nitric oxide producing enzymes weaken over time. This is not theory. Multiple randomized controlled trials show that beetroot juice significantly improves endothelial function, the health of the inner lining of arteries. When that lining works properly, arteries relax, widen, and resist damage. When it fails, plaque sticks, pressure rises, and blockages form. That is why beetroot has been shown to lower systolic blood pressure within hours of consumption, sometimes by amounts comparable to prescription drugs. But blood pressure is only the beginning. Improved nitric oxide availability increases blood flow to the heart, brain, and muscles. This means more oxygen delivery and less strain on the cardiovascular system. For older adults, this translates into improved stamina, better walking performance, and reduced cardiovascular risk. Studies even show improved oxygen efficiency during exercise, meaning the body does more work with less effort. Now enter lemon. Small in size but powerful in function. Lemon is rich in vitamin C, a nutrient that directly protects nitric oxide from being destroyed inside the bloodstream. This is critical because oxidative stress increases dramatically with age. Free radicals attack nitric oxide molecules, shortening their lifespan and weakening their effects. Vitamin C acts like a shield, preserving nitric oxide long enough for it to do its job. But lemon's role goes deeper. Oxidized LDL cholesterol is one of the most dangerous forms of cholesterol because it triggers inflammation and plaque buildup. Antioxidants found in citrus fruits help reduce LDL oxidation, making cholesterol less likely to damage arterial walls. This is not about lowering cholesterol numbers, it's about changing cholesterol behavior. Research shows that people with higher vitamin C intake have better arterial compliance, meaning their blood vessels remain more elastic instead of stiff. Arterial stiffness is a strong predictor of heart attack and stroke, especially after 60. Lemon helps address this at the cellular level. Then there is ginger, often underestimated, but one of the most studied medicinal roots in the world. Ginger contains bioactive compounds like gingerols and shogaols that exhibit strong anti-inflammatory and antiplatelet effects. Chronic inflammation is a driving force behind atherosclerosis, the slow thickening and hardening of arteries. Ginger helps quiet that inflammatory signaling. Studies show ginger improves circulation by enhancing blood vessel dilation and reducing blood viscosity. Thicker blood increases clot risk, especially in older adults. By supporting healthier blood flow, ginger reduces the conditions that allow clots to form and travel. Ginger also improves insulin sensitivity. This matters because elevated blood sugar damages blood vessels from the inside out. Even mildly elevated glucose accelerates arterial aging. By supporting glucose regulation, ginger indirectly protects the vascular system. When beetroot, lemon, and ginger are combined, the effects are not merely additive. They are synergistic. Beetroot increases nitric oxide production. Lemon protects it. Ginger enhances circulation and reduces inflammation. Together, they target three major drivers of blocked arteries: poor blood flow, oxidative stress, and chronic inflammation. This is why people who consume this drink consistently often report warmer extremities, fewer cold hands and feet, improved energy, and reduced dizziness. These are signs of improved circulation, not coincidence. Clinical nutrition research emphasizes that timing and consistency matter. Drinking this combination daily trains the vascular system to respond better. Blood vessels are dynamic tissue. They remodel based on the signals they receive. This drink sends a signal of relaxation, nourishment, and repair. There's also an important neurological benefit. Improved blood flow to the brain enhances cognitive performance, focus, and memory. Reduced cerebral blood flow is a known contributor to age-related cognitive decline. By improving vascular health, this drink supports brain longevity. And here's a fact that should stop you in your tracks. Autopsy studies show that many people who die suddenly from heart attacks had no prior symptoms. Their arteries were silently narrowing for decades. Interventions that improve endothelial health are among the few strategies shown to reduce this silent progression. This drink is not a cure, it is not a miracle, but it addresses mechanisms modern medicine recognizes as central to cardiovascular aging. That is powerful. What makes this combination even more remarkable is its accessibility. No prescription, no expensive equipment, just foods that communicate directly with your biology. After 60, your body's not broken, it is undersupported. When you give it the right signals consistently, it responds. The tragedy is not aging. The tragedy is ignoring what science has already revealed. Every glass of this drink is not just nourishment, it is information. It tells your arteries to open instead of close, to heal instead of harden, to flow instead of resist. And when blood flows better, life feels different. Energy returns, clarity improves, the heart breathes easier. This is not about living forever. It's about living well, with arteries that still remember how to protect you. And that is the true power behind this simple drink. The most dangerous myth after 60 is not that aging causes disease. It's the belief that one good habit can cancel out a lifetime of bad signals. Science is very clear on this. Your body is not changed by what you do once, but by what you repeat. Consistency is not motivation. It is biology. Every single day, your body is rebuilding itself. Blood vessels, muscle fibers, neurons, even the lining of your arteries are constantly being repaired, replaced, or damaged based on the signals they receive. Food, movement, sleep, stress, and hydration are not lifestyle choices. They are instructions. And after 60, the margin for error becomes smaller. Research shows that cardiovascular disease does not begin in old age. Autopsy studies have found early arterial plaque in teenagers. By the time someone reaches their 60s, the disease process has often been active for 4 or 5 decades. This means reversal and stabilization require time, repetition, and patience. There is no biological shortcut. This is why one healthy drink taken once a week does almost nothing. But the same drink consumed daily for months can measurably change blood pressure, endothelial function, and inflammatory markers. The body responds to patterns, not intentions. Clinical studies consistently show that dietary interventions only improve vascular health when followed consistently for at least 4 to 12 weeks. Nitric oxide levels rise gradually. Arterial stiffness decreases slowly. Inflammation markers fall over time. These changes are invisible day to day, but powerful when compounded. This is the same reason many people say, "Nothing works for me," when in reality nothing was done long enough for the biology to respond. But consistency alone is not enough if the surrounding lifestyle sends conflicting signals. Take physical movement. You do not need intense exercise after 60, but you do need regular movement. Research shows that even light daily walking increases nitric oxide production, improves insulin sensitivity, and reduces arterial stiffness. Sitting for long periods, even in people who exercise occasionally, is associated with higher cardiovascular risk. Your blood vessels need movement to stay responsive. Sleep is another underestimated factor. During deep sleep, the body repairs endothelial damage and regulates inflammatory pathways. Chronic sleep deprivation is linked to higher blood pressure, increased plaque formation, and impaired glucose metabolism. One study found that sleeping less than 6 hours per night significantly increased the risk of heart disease, regardless of diet. Hydration matters more than most people realize. Blood is over 50% water. Mild dehydration thickens the blood, increases clot risk, and strains the heart. Older adults often have a reduced thirst response, meaning dehydration can occur without obvious warning signs. Then there is processed food. Ultra-processed diets increase oxidative stress, damage the gut microbiome, and promote chronic inflammation. This directly counteracts the benefits of any healthy drink or supplement. You cannot signal healing with one habit while signaling damage with another. Stress deserves special attention. Chronic stress raises cortisol levels, which constrict blood vessels, raise blood sugar, and promote abdominal fat accumulation. Over time, stress-induced vascular constriction contributes to hypertension and endothelial dysfunction. This is not psychological weakness. This is measurable physiology. Studies show that people who practice stress-reducing behaviors, such as deep breathing, mindfulness, or regular relaxation, have improved heart rate variability and better vascular function. Calm is not a luxury, it is protective. And here is a shocking truth supported by decades of research. Medications manage risk. Lifestyle changes modify the disease itself. Drugs can lower blood pressure or cholesterol, but they do not teach blood vessels how to function better. Consistent, healthy habits do. This does not mean medication is bad. It means medication works best when the body is supported, not neglected. One of the most powerful findings in cardiovascular research is that small improvements across multiple lifestyle factors produce exponential benefits. A modest improvement in diet, combined with daily movement, improved sleep, and stress management, dramatically reduces cardiovascular events compared to focusing on one factor alone. This is called the synergy effect, and it explains why consistency across habits matters more than perfection in one. After 60, the body becomes more sensitive to both positive and negative inputs. This is why some people feel better quickly when they make changes, and worse quickly when they abandon them. And here's the emotional truth many don't want to face. Waiting for symptoms is a gamble. Blocked arteries often show no warning signs until the moment they fail. The absence of pain is not the absence of disease. Consistency is not about fear. It is about respect for how the body actually works. Every day you repeat a healthy habit, you are reinforcing pathways of repair. Every day you skip it, those pathways weaken. This is not punishment, it is feedback. People who age well are not lucky. They are consistent. They don't rely on motivation. They build routines. They don't chase miracles. They honor biology. And perhaps the most empowering fact of all is this. Even after decades of damage, the body can still improve. Studies show that adults in their 60s, 70s, and even 80s can improve blood vessel function, muscle strength, and metabolic health when consistent changes are applied. It is never too late for the body to respond, but it will only respond to what is repeated. This is why lifestyle is not a side note to health. It is the foundation. And after 60, it becomes the difference between surviving and truly living. The question is no longer whether healthy habits work. Science has answered that. The real question is whether you will give your body the time, consistency, and respect it needs to show you what it is still capable of doing.